Hello everyone, my name is Ariel Foster. I'm a third-year pharmacy candidate from Miami, Florida, and today I will be presenting my journal club for evidence-based medicine. So to begin, the title of my study was The Efficacy and Safety of LCZ 696 compared to olmesartan in essential hypertensive patients. My study was funded by Novartis Pharmaceuticals. A little background information on my study. LCZ 696, whose brand name is Entresto, is actually a combination drug for use in heart failure patients. It was developed by Novartis Pharmaceuticals. It's a first-in-its-class medication consisting of an angiotensin receptor blocker, valsartan, and a neprilysin inhibitor, sacubitril. The combination is described as a angiotensin receptor neprilysin inhibitor, and it was approved under the FDA's priority review process on July 7th, 2015. So for the methods section of my study, the objective of this study assessed the efficacy and safety of Entresto in comparison to olmesartan in essential hypertensive patients not adequately responsive to olmesartan. Just for the ease of this presentation, I will be referring to LCZ 696 as Entresto, just in case you guys are wondering. The trial design was a randomized, double-blinded, parallel group, active controlled study that took place in the United States. For my inclusion criteria, there were actually 4 of them. The first one was patients with mild to moderate hypertension, untreated or currently taking antihypertensive therapy. Number 2, for the treated patients, they had to have a systolic blood pressure of over 145 and less than 180. And they also had to have a washout period of 4 weeks. Number 3, for the untreated patients, which were patients who were newly diagnosed or those who just weren't taking any medication for their hypertension, they also had to have a washout period of 4 weeks, and they had to have a systolic blood pressure of over 150 but less than 180. And number 4 were patients who successfully completed the ambulatory blood pressure monitoring requirement to be qualified for randomization. For exclusion criteria, there were 4 exclusion criteria as well. The first one were any patients who had malignant or severe hypertension, which included if they had a diastolic blood pressure of over 110 and a systolic blood pressure of over 180. Number 2 was a history of angioedema. Number 3 was any evidence or history of secondary form of hypertension, including but not limited to renal vascular hypertension, coarctation of the aorta, primary hyperaldosteronism, Cushing's disease, pheochromocytoma, polycystic kidney disease, and drug-induced hypertension. And number 4 were patients who were previously entered in a study involving Entresto. Those patients were not used for this trial either. Subjects were 18 years and older, men and female, and there were no healthy volunteers, only volunteers that had essential hypertension. The primary endpoint of this study was to see a change from baseline in 24-hour mean ambulatory systolic blood pressure, and the 2 secondary endpoints were to see a change from baseline in mean 24-hour ambulatory diastolic blood pressure, and to see the number of patients who achieved success overall blood pressure control. There was no follow-up. The duration was 8 weeks, and the population was 376 patients. The arms, there were 2 arms. The first arm was the experimental arm, which were patients treated with a 200 milligram tablet of Entresto, 1 tablet for 8 weeks. And the second arm was the active comparator arm, which were patients treated with the olmesartan 200 milligram capsule once daily for 8 weeks. An overview of the statistical analysis where the method was ANCOVA. The p-value was less than 0.001, and the standard error of mean was 0.78. For For the results section, just to do a review of my study, once again, it was randomized. The primary purpose was for treatment. The study was double-blinded, and the intervention model was parallel. For the primary endpoint results, patients treated with Entresto experienced an average 4.26 decrease in their mean ambulatory systolic blood pressure from baseline, while patients treated with olmesartan 20 mg saw a 1.04 average decrease in their systolic blood pressure from baseline. For the secondary endpoints, patients treated with Entresto experienced a 2.27 decrease in their mean 24 ambulatory diastolic blood pressure from baseline, while patients treated with olmesartan saw a 0.35 average decrease in their diastolic blood pressure from baseline. For the second secondary endpoint, following the intent to treat analysis, there was a 40% success rate for patients treated with Entresto, and there was a 28% rate for patients treated with olmesartan. Common adverse effects seen were headache and dizziness. There was one event of cerebrovascular accident and 2 events of benign neoplasm, including one of the thyroid gland. For a critique of this article, some of the strengths I saw, well, with treatment being the primary goal of this study, I would say that their intention to show that Entresto lowered blood pressure more than olmesartan was clearly established. Their inclusion criteria for patients with untreated or treated hypertension, along with the levels of systolic blood pressure and diastolic blood pressure required, those were clearly established as well. There was no selection bias, as the trial was randomized and included both female and male over 18, so it wasn't just for the elderly. It had a good range. One weakness associated with this trial was the attrition rate compared with both drugs. What I noticed was that more people taking the olmesartan dropped out of the study than those taking the Entresto, for reasons that was not explained, and that could cause some sort of bias with how the numbers came out, with how Entresto basically could be seen in a better light than the olmesartan. A summary of the study. In conclusion, the study showed a significant decrease in mean arterial systolic blood pressure and mean arterial diastolic blood pressure when using Entresto for 8 weeks when compared to olmesartan. Entresto was only given once a day for the trial, when its intended dose is actually twice a day, suggesting that the benefits may be even greater in clinical use. Out of 376 participants, 22 were not able to complete the trial due to adverse events, lack of efficacy, physician decisions, and non-compliance. For the application and conclusion, as a newly approved drug, Entresto, which includes valsartan and sacubitril, may show some promising cardiovascular effects as compared with existing medications used in heart failure. Entresto has also been involved in a number of other studies, one including the Paradigm heart failure trial, where its efficacy was tested against enalapril. Heart failure, as we all know, is a life-threatening condition that affects more than 6 million Americans. So I believe that if this drug does show some promising mortality benefits and can reduce strain on the heart, I believe it's worth a try in clinical sense to see if it will help heart failure patients. And with that said, I would just like to thank you all for listening to my journal club, and thank you all for your time. Thank you.